this is Janice Lopez from the International Organization for Migration, and welcome to the Migration Health Research Podcast. In this issue of the Migration Health Research Bulletin number 26, we feature articles, reports, and technical briefs focusing on migrants' access to healthcare information and services, health impacts of air pollution, as well as syndromic screening and disease surveillance. For the audio podcast episode, we feature two interviews, one with Leung and the other with Ursula Trummer. Leung is the IOM Migration Health Regional Thematic Specialist for Southern Africa. She shares the findings of a test review to determine the rights of migrants to access healthcare services in the 16 Southern Africa Development Community member states. Let's listen to Leung.
In 2022, the IOM Regional Office for Southern Africa commissioned a study to the University of Witwatersrand, led by Professor Jo Veery and her team at the African Centre for Migration and Society here in South Africa. So it was a desk review that aimed to determine the rights of migrants to access healthcare services in 16 Southern African countries as defined in their national legislation and policy. For the purposes of the studies, we were looking at migrants and where migrants were defined as international migrants or non-citizens, including persons holding various temporary, permanent residency permits, migrant workers, asylum seekers, refugees, undocumented migrants and others. So it didn't look specifically at internal migrants with the assumption that their rights to access healthcare would remain the same regardless of their place of residence within a country. I mean, we do understand that there could be other challenges in accessing healthcare. And we were also interested in only looking at access to state-provided or public healthcare services. The 16 countries are the same 16 member states of the Southern African Development Community, or SADC. And so really the study was asking, what do national constitutions, legislations, policies and associated frameworks say about the rights of non-nationals to access government healthcare services across the Southern African region? And the study really built on a similar review that we at the regional office, again with Witwatersrand University, conducted in 2009 that looked at a similar question. And the motivation for renewing this review were really twofold. So firstly, we've continued to observe in the region the need for a one-stop resource that helps guides health practitioners, administrators and policymakers to understand where the law and government policy stands on fulfilling the rights of migrants' access to healthcare. And we see often practitioners are faced with having to navigate several policies and legislations. For example, a health administrator working to provide occupational health services to migrant workers may have to consult a number of acts and policies. For example, National Employment Acts, Immigration Acts, Public Health Acts, disease-specific national strategies where migrants or migrant workers may be considered as priority populations, national constitutions and so forth. So on a very practical level, we wanted here at the regional office to develop this resource for practitioners. On a kind of wider level, I guess secondly, we also wanted to support and facilitate a process that many governments are going through in terms of committing to achieving universal healthcare coverage by 2030. And this includes progressively ensuring that the rights of migrants to accessing healthcare in a full range of quality health services that they need and when they need without financial hardship is realized. So to support the monitoring process towards this goal, we wanted to have a stock taking of what is prescribed by states in their current legislation and policy.
On to my next question, Kate. You mentioned that you employed desk review for this study. Do you want to elaborate more on how the study was conducted?
Sure, that's right. It was a desk review, so national legislation and policy documents that had the potential to prescribe the right to access to healthcare services of populations, including preventative, curative care, were collected from across 16 countries that were included in the study. So this was done by both an internet search by the research team, as well as a request made to the IOM country offices in all 16 countries who work closely with their Ministry of Health counterparts to ensure that all the available legislation and policy documents were included in the analysis. So in total, 145 documents were included in the analysis, and this really ranged in terms of the types of documents that prescribe the right to health for non-citizens or international migrants. These included, for example, Immigration Control Acts, Public Health Acts, Refugee Acts, National Occupational Health and Safety Policies, employment regulations, national strategic plans on different key diseases, mental health acts, national sexual reproductive health policies, disaster management acts. I mean, it's a long list. It's not just pure health policies, but also those from other sectors as well. And then the next stage for the researchers were to conduct country-level reviews, rating each policy or legislation against 4 key questions that we looked at. So the first one was, is the legislation or policy migration aware? Meaning, did it have specific directives or actions addressing migration or migrants? The second was, does the legislation or policy adopt universal healthcare coverage principles? And if so, does it consider migrants and migration? The third question was, does the legislation or policy consider the health of migrant workers and or occupational health? And then the fourth one was, do international migrants have the right to access public healthcare services? So it was quite a detailed mapping against these 4 questions. And then each document itself was kind of graded on a matrices that was developed by the research team to see where it sat. And at the end, analysis was done on the overall trends across countries on the prescription of right to access to healthcare and to the degree in which policies are migration aware. I guess at this stage it's important to note that there are limitations to the work that was undertaken. So they were reviewing constitutional, legislative and policy ambitions of each country, but did not speak to or did not examine to the degree in which these policies and legislation are implemented. So the findings themselves presented in the review do not reflect perhaps what may be happening in practice in terms of the realities of migrants or non-citizens accessing healthcare services. And further, it was limited to the policy documents that were publicly available and easily searchable or attainable.
Very interesting, Kit. Thank you for sharing that detail to us. My next question would be, would you like to share with us the findings from this study?
So the review showed that the majority of the 16 countries that were included in the analysis offered limited access to healthcare for international migrants as stimulated in their national constitutions, legislation and policies. Comparing to the review that was conducted in 2009, whilst we have seen a trend towards increasingly migration-aware legislation and policy across the region, meaning, for example, that increasingly the policies that we reviewed recognize the importance of migrants and migration in their different health interventions. Often, for example, they cite migrants as a key population. When we looked at the legislation and constitutions, the rights of migrants to access healthcare services remain limited when compared to the rights of citizens. So meaning prescription by law on migrants' rights to access to government and healthcare remains limited and lags slightly behind a movement we're seeing towards awareness and understanding of migration and its impact on health as a whole. There were some other findings, and again, this is something that we probably need to look into a little bit further. One was an observation that many states, for example, specify access to refugees and asylum seekers in legislation more specifically, but remain very much silent on other groups of migrants, including undocumented or regular migrants. We also saw that much of the legislation remains quite vague, leaving room for interpretation, often referring to all persons, but not being further prescriptive on migration status. We also saw a trend where free access is granted to non-citizens. It's often very prescriptive. For example, it's prescriptive specific services, including emergency medical services or services to specific groups, including pregnant and lactating women or children under a very specific age or certain age, as well, for example, for services for notifiable conditions of public health. So very prescriptive on the services that they're allowed to access. We also found very limited coherence across policies and some contradictory articles across them, but certainly more examination can be undertaken. And this is very much our hope that now we have this open resources, it's available to scholars and researchers to further investigate and look at different aspects of different policies in the region.
So as my last question, what are the implications of this study for policy or program, especially within the SADC?
So part of our intention behind the review was to build a resource, like I said, that would be a tool to assist states in monitoring and reporting against their commitments towards achieving universal healthcare coverage, where increasingly states have recognized that migrants need to be progressively included. Therefore, the implications for the study, we hope here at the regional office, is to build accountability around this progress and have almost like a policy benchmark in which we can assess and evaluate changes changes in policies and legislation over time. We had at the regional office the opportunity to present and discuss the review with migration health focal points from 8 out of the 16 countries that were included in the study at the recent regional migration dialogue for Southern Africa that was hosted by Malawi in October 2022. So we had some reflections on the findings from states themselves, which were interesting, and they included a few things. First was a recognition that health systems, despite what may be included in legislation and policy, have several examples of where they ensure access for non-citizens at a delivery level, and that there's a greater need for this to be reflected as policy gets reviewed and updated over time, and that there is, in fact, a good opportunity with similar pieces of work to be able to feed into universal healthcare coverage accountability mechanisms that governments are now putting in place across the region. We certainly hope that this review will help facilitate further discussions by governments and regional stakeholders in helping them understand in where they stand in terms of conferring rights to migrants and accessing public healthcare services. And in a sense, we hope that this will provide a baseline and also a real resource for practitioners, as mentioned earlier. It is available, publicly available, and in this year we do hope to make it further available, including the annexes and the detailed analysis against each policy and legislative document. So hopefully watch this space.
We also talked to Ursula Trummer, the head of Center for Health and Migration in Vienna, Austria. She provides an overview of the health challenges faced by international migrant workers globally. Let's listen to Ursula Trummer.
I think the main driver for this report was that it was done in the context of the WISH 2022 forum. So WISH stands for World Innovation Summit for Health, and it is done in Qatar. And for this year's, for 2022 topic, the main topic was about migrant workers. And the choice of this topic is connected to the World Championship of Football, because along with the World Championship of Football, there was shed light on the situation of migrant workers who came to Qatar and did build all this fancy, wonderful infrastructure that was needed to conduct the World Championship there. Main aim was to shed light on the situation of migrant workers regarding their health, their access to healthcare, and of course their living and working conditions, so the wider social determinants to their health as well. Another main topic was the question, what can be done to ensure access to quality healthcare for everybody, and especially for such vulnerable population groups like migrant workers.
In line with this, Ursula, with the objectives that you have just shared with us, can you walk us through the study's methodology that you have used?
We did some desk research on numbers of international migrant workers and on their situation concerning legal frameworks of access to healthcare and provisions to ensure that access to healthcare is guaranteed and granted. We did collect expert opinion, and we collected some case studies on international level from Europe, from Singapore, and from Africa to illustrate some practice or policy examples on how access to healthcare for migrant workers can be ensured and fostered.
Can you share with us some key findings relevant to the Qatar landscape and the global landscape in general in terms of migrant health?
Well, it would be too much to shed light on the Qatar situation, because actually in this report we concentrated on the international situation of migrant workers. And I think it's important to see the estimates globally. When you look at the situation of migrant workers, international migrant workers globally, we can see from numbers from ILO that 169 million international migrant workers can be documented for 2019. And the majority of these workers are male. It's 58.5%. But you can see already that more than 40% are women. International migrant workers are also very heavily counting on women to leave their home country to look for work abroad. And what we can also notice that those international migrant workers are very important drivers of economic and social development, both for their countries of origin as well as for the countries they go to become a part of the workforce there. Another interesting thing that should be noted when we look at international migrant workers is where do they go? What are the receiving regions worldwide? And we can see we have a top 3 destinations, so to speak. The first destination where many international migrant workers go is Europe. It's Northern, Southern and Western Europe. Approximately 25%, if we put the exact numbers, is 24.2% of the documented international migrant workers go to Europe. 22.1% go to Northern America, and 14.3% go to the Arab states. The Arab states constitute a very specific case or situation because the Arab states have rather low population rates. For example, take Qatar. Qatar has now around 3 million, but Qatari nationals are around 300,000 inhabitants. So you can see the ratio between Qatari citizens and migrant workers is tremendous. And if you look at the whole region, you can find that the share of migrant workers in the overall labor workforce is reaching over 40%. So 41.4% of the overall labor force are migrant workers. And this is an interesting number because you can see how heavily the whole region is depending on labor, on a workforce that is not a national workforce but comes from somewhere else. This number also gives you an indication of the importance of migrant workers, of a migrant workforce to keep up economic and social development for the countries where they go to. And if we look at areas for international migrant workers where they are working, it's construction work, it's agriculture, it's domestic work, especially for women. And I would say that domestic work is, again, a very specific area because domestic work happens behind closed doors. One future topic for future research should be domestic work.
Ursula, before I go to my next question, actually to my last question, would you like to expound a bit also, because you mentioned earlier that one of the aim is to also look at the healthcare access of the labor migrants in Qatar. Do you want to expound on that as well in terms of the findings?
I think what can be said generally and globally is that in many, many countries, regulations concerning access to healthcare for migrant workers are in place. So it's not necessarily a problem of regulations. And if I look at Europe, for example, we can see that especially in the welfare states, they have very clear regulations and very protective regulations concerning a migrant workforce. So, for example, when you are a documented member of a workforce, if you have a valid contract, then basically on level of regulations, you are included into the public health systems. And basically you have access on level of regulations to a wide range of services within the European welfare states. But still, what we can see, there is evidence that international migrant workers, especially when they work in those typical 3D jobs, demanding, dirty, degrading, there are really many, many obstacles to enjoy those rights that they are given by regulations. So regulations are in place, but they can easily be bypassed in practice for many, many reasons.
Going to my last question, Ursula, I noted in the report upon reading it that there was a recommendation that you have reiterated there saying that an intergovernmental, globally oriented health framework is needed. Do you want to expound on that, or could you expound on that along with the other key recommendations for policy or program from this study that you would like to share to the audience?
One main point is that we need to consider the entire migration process. From the very beginning, from the role of recruiting agencies, from the role of programs to check the health of migrant workers in pre-departure situations, the journey, the temporary settling in the country where the work is done, the return phase, and then the reintegration into the country of origin. So And within this entire migration process, you have specific different authorities and nation states who should cooperate, who should work together, cross-sectional, cross-regional, and also in agreements between countries to ensure that the health and well-being of migrant workers is considered, is fostered along the whole process. And this by definition cannot be done at one single place. Another key finding, I mentioned it before already, is that regulations concerning access to healthcare and access to decent living and working conditions are in place. But it's sometimes very, very difficult to access those rights, to put these rights, to put these regulations really in practice. You have a law in the books, but that does not mean that this law has an impact in practices. So it is very important to look into the living situations, the working situations of migrant workers and to ensure that these are health promoting, because health is the most important thing that migrant workers have. They need to be healthy to be able to do their job and also to sustain their family relations. And that's another point I would like to make. I think what also needs to be considered is the issue around transnational families and the family dynamics that comes along with that. It is, I think, very, very important to look at the broader picture, not only at one single individual who's going abroad, but to look into families and the dynamics of transnational families where one or several members of the family need to leave and need to generate family income somewhere else. When it comes to access to healthcare, besides regulations, one recommendation from this report also is that we need to look at aspects around culture, around language, around literacy, around empowerment, around self-esteem of migrant workers as well. We really need to change the narrative because the prevailing narrative seems to be that people are desperately looking for work and they are the ones who have to ask for something. Can I please work in your country? Please give me a job. And then somebody decides yes or no, also considering the health status. But I think we really have to change this narrative because what we can see that societies all over the world are really in need of migrant workers to sustain social cohesion, to sustain healthcare systems. It's not the migrant workers who should be asking for somebody or something. It's really societies, it's communities who should ask for migrant workers to please do come and live with us and work with us. And let's live and work together.
Thank you very much, Kit and Ursula. And thank you all for listening. Please feel free to share your feedback with us. See you on the next podcast.